Good afternoon, all. It's 2 p.m. Eastern Standard Time on March the 31st, 2021. My name is Chuck O'Neill. I'm Deputy Director of Administration with the Kentucky Board of EMS here in Lexington. We appreciate you being with us today, and I'm sure some folks will come on in as we're going through the updates today. I'm showing 48 participants today, and I think we had around 70 some odd registered this time around, but we do appreciate you attending today. Hopefully we'll give you some good information that can assist you in the field, and we can exchange some information to make sure that we're also updated here at the state office. But we'll get started today with Paul Phillips, the Director of Field Operations, for an update. Paul.
Good afternoon, everyone. Thank you all, as Chuck said, for joining us. These are information sharing sessions, and we hope that you all are getting a lot out of them. If you feel like you would like something added that we don't get to, reach out to us and let us know, because we would love to hear if you'd like to see anything else shared. So I'm going to share the personnel accountability report, and this is a pretty monumentous occasion. Here in the office, we were just talking about it, and we're excited to report that we have 3 EMS providers, as reported this week, that are out quarantined, isolated due to COVID. We have 2 EMTs, 1 AEMT, and no paramedics. This is a huge event, especially looking back 4 months ago when we were at nearly 200 every week. Now we're at 3. I believe pretty much I can say that if you haven't received the vaccine at this point, it's probably because you don't want to, and that is your choice. But again, we will encourage those who want to. And if you're not getting the vaccine, please reach out to your local health departments and try to coordinate that, because that is I think that's a good step towards where we want to go. Just going to update you on a few internal processing issues. First off is payment processing. We know that it is a little slow. We are working through several different issues. One is that our financial analyst has moved on to a different position, and we are working diligently to fill that. We have some processes in place that we keep refining each week, and we're getting a little better. But then we also found out that there are some mail issues. I'm sure everybody's experienced slower mail than usual. We actually got checks last week that were postmarked mid-January, possibly due to our move, possibly due just to slower mail at this point. But it has been slow. I even know that from my home mail has been a little slow. Want to update you all on agency renewal applications, your agency renewal and inspection app. We have over half that have not started their app. I cannot stress how important it is to go ahead and start the app, because once you start the app this year, before you get access to the renewal portion, or to the inspection portion with uploading all your policies, we're requiring payment. And that is just so we don't have to chase down at the end of the year. And also to kind of remind everybody, if you need to request a check from your fiscal court, from your treasurer, whoever you need to request payment from, go ahead and do that sooner rather than later. It's just going to be a whole lot smoother on the back end of the year if we go ahead and get that all done. Just going to update you. We're involved here here within the K-Beam's office in the mass vaccination sites, and these are I guess you'll call them the Kroger sites. They are transitioning those as we speak from drive in, walk up to drive through. Then you can expect that, especially as the weather changes, I think you'll start seeing more of those pop up. I think there's over 600 places, as we were talking yesterday, in the state to get vaccines now. If you have any suggestions, reach out. We would love to hear those. But I think overall, I'm pleased with how the processes went, especially from our perspective. Okay, so I also want to update you on EMS Week. We're trying to look forward a little bit this year, and we've started plans from our perspective. And I think Greg Howells, our marketing manager, is going to share a link to an infographic that will kind of lay out some of the things that we're wanting to do this year to engage on social media. We're well aware that with the COVID restrictions, we're probably not going to be able to do the in-person things that we would like to do, whether that be classes. We are looking at some educational offerings or partnering with other agencies for educational offerings during EMS week, and we'll share out more about that as we get things nailed down. But I wanted you guys to know we are working towards that. Another thing we're doing for EMS week, we've reached out to the Kentucky County Judge Executives Association. We always try to get a proclamation from the governor, and that's great. But I think one of the things that I personally wanted to see done was to try to drive it in a more local fashion. So we've asked the County Judge Executives Association, and they've agreed that they are going to share down a sample proclamation and try to drive it to a more local level so that you guys can get a local proclamation from your county judges. My hope is that this will prompt them to celebrate you guys more at a local level, and also to even know that EMS week is a thing. I think a lot of them, especially when they change over from administration to administration, just don't know, and that's really, it's probably not their fault. They just don't know what they don't know. So we're going to try to drive that down to the local level a little more this year. We encourage you guys to reach out to them, engage them, try to get them to share those proclamations and participate with the stuff that we're doing and with the things that you all are doing. You know, we often talk about how our county administrations don't know what's going on, but sometimes we got to meet them halfway. So reach out to them, meet with them, have those conversations, let them know how they can celebrate your staff, because those are important. And if there's ever been a time that they may be more willing to help celebrate, it's probably now. So reach out. I guess that's really all I've got to share. I'm going to hand it off now to our Director of Education and Training, Bob Andrew.
Thanks, Paul. NREMT has extended their provisional certification through June 30th of 2021. Anyone that tests the psychomotor exam, EMR, EMT, AMT, or paramedic and passes will be automatically assigned a provisional certification. Once the person completes the psychomotor exam, then they'll receive the full registry certification. And remember, K-Beams is accepting the provisional certification as a regular certification for initial certification and licensing. The provisional certifications will remain valid through December 31st, 2021, or until the provider passes the psychomotor exam. After December 31st, 2021, the provisionals that EMS providers hold will expire. So you want to make sure you take care of that if you want to keep your national registry, if you happen to have a provisional certification. Always remember, you can go to nremt.org, and under their news, you'll find recorded webinars and any other information about NREMT. If you have any questions for NREMT, they now have a support portal. It's best to communicate with them that way. It's support@nremt.org. That's pretty easy. I use it. It works. EMSTI renewal for 2021 is underway. March the 31st, 2021 is the deadline. That's today. There's a list of EMSTEIs that are due to renew by today, and that can be found on our KBMS website under the EMSTEI renewal banner. New CE courses that are on the train.org website, the Pediatric Abusive Head Trauma that Kentucky EMSC was able to get online for us. The First Responder for Narcan Administration training through the Kentucky Department of Public Health. It's a 1-hour course as well, and it meets the FR Care grant participation requirements. If you're one of the 20 counties in Kentucky, in Eastern Kentucky, that are participating in that right now. All certification and licensure cards have been mailed. They're being mailed weekly. We're up to date on those. Just to let everybody know that we did not issue cards to folks that received emergency reinstatement when the fee was waived. So that would have been last March and through 2020 when that was in effect. So if you reinstated and you did not have to pay a fee, you did not receive a card, and we will not mail you one unless you pay for it. When you renew your certification or license, you'll receive a card. You can always find a PDF copy of your card in the document section of your ChemSys account. Also on our website, at the very top above the Kentucky Board of EMS name, you'll see a verification link. We highly recommend that anyone wanting to verify their cert or license, or anyone else's, go there to do that, because it comes directly from ChemSys. EMS Continuing Education is still available on our website, kyems.com, under Education in the gold banner, and then Continuing Education. We'll update this as we get new continuing education, and other folks are sharing CEs with us. The JBL continuing education packages that are $1 a credit hour, these are the core components of the Kentucky requirements, and that's a really good deal. Jones & Bartlett is finalizing the NREMT NCCP CE package for us. So they tell me it should be a month or two. We'll have those on our website as well. So you'll be able to fulfill your NREMT NCCP CE package. And we're going to work very closely with them on the pricing to try to keep it the same. The Sexual Violence Awareness Training course should be available online July of 2021. I'm working with the Kentucky Association of Sexual Assault Programs to update the course before we place it online. Had a meeting with them today. I was able to confirm that they're willing to do another train-to-trainer course for us. So that will be in June of 2021 on Zoom, and we'll be advertising that as we get closer. Our tentative enforcement date on the sexual violence awareness training will be in 2022. So those renewing in 2022 will need to have the sexual violence awareness training course, and it'll be available online free of charge, 1-hour course. The Castle Branch COVID-19 delays have been resolved. Mr. Renewal, working with our Castle Branch contact, is able to resolve the county issues that we've been having due to COVID-19. For those that have their background check connected to a national search, he was looking those up by county and clearing those off. So as far as I know, today, there's nobody in the holding pattern. If you have a provider who you're waiting to get their cert and license to work, and it's because of Castle Branch, have them submit a support ticket, and I'll get right on that to try to clear that up. The HIV AIDS course that we had in the resource page under education was removed and is being revised from 2 hours down to 1 hour. And we're hoping to have that online as well, probably within the next month or two. We're still operating under the COVID-19 emergency regulations. So I would recommend that If you have any questions about certification and licensure, go to the COVID-19 Health Alert at the top of our webpage, click the Read More, and then look at the checklist. They were updated on February the 17th, and the regulations. Changes to reinstatement. Right now, it requires proof of previous certification and licensure, a background check from AOC, and of course, pay the fee. Changes to temporary, just a reminder, all expiration dates for the COVID-19 temporary certifications that were issued were changed to October 1st of 2021. If someone holds a temporary certification that was issued through the COVID-19 emergency regs, they'll need to complete their NREMT certification testing prior to October 1st. After they receive their certification, their provisional certification or regular, they would apply for their initial certification or license with us using that card. I get a lot of calls from folks that don't know this, that hold a temporary. So anyone that holds a temporary certification or license with us, if you have a National Registry provisional certification, go ahead and apply for your initial certification or license with us. We accept that card. If you don't get the testing done by October 1st of 2021, then you'll need to submit an application for downgrade so that you can downgrade to your previously held certification or license. And you need to do that before that October 1st, 2021 expiration date. I'd recommend starting at least 2 weeks before that date if you're not going to be able to get your testing completed. Most answers can be found on our website. However, if you still have questions, the best way to communicate with us is through our support ticket portal, and that's kyems.com on our website. On the left-hand side, the octagon, quarter of the way down, that's blue, says support. Click it. If you don't have a support ticket account, you'll need to create one. It is not your KEMSIS account. And that's all I have, Paul. I'll hand it off to Monica. Thanks.
Good afternoon, everyone. I'm Monica Robertson. For those of you who do not know me, I am the Director of EMS Research here at KBeams. I just wanted to jump on the call this afternoon very briefly and just make an announcement that there will be several different data reports that we're going to share out to you all and to the public. These reports will be made shareable through our Facebook page as well as the website, the KBeams website. These reports include incident data that you all have submitted to KSTARS. These reports are looking at stroke and STEMI incidents. We're going to do a EMS Compass Measure study. The attrition study will be released. MIHCP quarterly data report will be released, as well as a 2020 annual report. So like I said, these will be released within the up and coming months through our KBeams Facebook page, as well as the KBeams website. And if you all have any questions, feel free to reach out to me, shoot me an email. My email is monica.robertson@kctcs.edu. And I just want to thank everyone for their timely data submissions, as well as the accuracy and validity of the data. We greatly appreciate it. So thank you all so much, and be on the lookout for those reports. So I am going to hand it off to the Director for EMSC, Morgan Skaggs.
Hello, everyone. It's Morgan. I just wanted to cover a few things. The annual EMS for Children survey of EMS agencies did close on March 20th. We closed with a survey response rate of 73%. So thank you so much to all of you who took the time to fill that survey out for us. It is part of our federal reporting. And while our participation rate was just a little bit short of our normal requirements for the feds, they did lower that this year, understanding that under the the COVID pandemic circumstances, it might be hard to reach that normal 80%. Personally, I like it when we can get closer to 95% of our agencies to participate. So I'll still be working on that for these future surveys. But thank you so much for taking some time during a difficult year and giving us that information that we need to both guide the direction of our program as well as report back to the federal government. Our voluntary EMS pediatric recognition program applications are currently under review. We have 21 applications in that we'll be looking at, and the EMSC committee will take a final vote to approve those on April 21st. Our official public announcement, we do a press release and we try to generate some publicity on EMS for Children Day, which is always the Wednesday of EMS week in May. So we'll be doing that. You should have seen, or at least the EMS agency directors or pediatric coordinators should have seen a memo that I sent out in regards to the scope of practice and the use of the NEO-T infant T-piece resuscitator. That was something that we had purchased a few of and had shared them for training purposes with a number of agencies. And because there was some confusion about that, the EMSC program asked the Medical Oversight Committee to provide some clarification. And because this is a device that includes adjustable settings for peak inspiratory pressures and peak end expiratory pressures for pediatric patients, it is limited for use to advanced level providers, so AEMTs and paramedics. If you do not have that memo or would like to get a copy of it or have more questions, I'd be happy to talk about that further. Participation in our annual EMSC survey and the recognition program can also sometimes lead to advantages to participation in some of our other program benefits, or at least preferential access. And so just to kind of highlight some of the things that we do on a regular basis and that we have coming up here in the near future. We have a hand-heavy instructor class that was postponed from last year that's been rescheduled that will be held on April 19th and 20th. This class is full. The EMSC program covered 2/3 of the student cost and reduced their out-of-pocket expense for the participant or the agency down to just 1/3, which is about $100. So we picked up all of the instructor team travel expenses as well as 2/3 of the individual participant costs. We are gathering interest. If you have someone who might be interested in the hand-heavy instructor course in the future, please email me, make sure I have their name on files, their email address, so that once we determine whether we're going to have that course, we can let everyone know that it's coming. Again, seats will be limited. We will cover a portion of that course fee. And again, agencies that participate in the annual survey and the recognition program will have preferential access to those spots. We also provide support for the PEP course, which is Pediatric Education for Pre-Hospital Providers. We did a very short survey in the last few days with the PEP instructors that are listed in the state about their needs. We've supplied a small number of access codes to the instructor orientation update course. And we also have a limited number of textbooks and access codes for the pre-test or the online modules. And again, there is a process that we develop on how you request those. They are limited in number, and we do provide preferential access to the agencies that have participated. We also have purchased the instructor toolkit for that program. And so if you have instructors that will be teaching that and you don't have the toolkit yet, they can get in touch with me and I can help them get access to that material. So it saves you a few dollars. We've also purchased a very tiny number of Furno PediMate Plus devices and NeoMate devices for safe transport of pediatric patients in ambulances. And we are working on developing some new webinars, both clinical focus as well as those targeting just the pediatric coordinators or online meetings for those agency PEC coordinators in the future. So stay tuned for those. Those are generally open to either all clinical staff or the PEC staff, depending on what the focus of that webinar is. But we try to make sure you're aware of all of these program initiatives. And if you heard something that you want to ask more questions about or have an interest in, please email me and we'll talk further. That's all I have today. Thank you.
Thank you, Morgan, for that update. We appreciate everything that EMSC is doing for the EMS community. Just a regulatory update on regulatory revisions for our administrators on the call. Currently, the following regulations have been approved by the Executive Committee on March the 18th and are scheduled to be heard by the KBEAMS Board of Directors on April the 8th. 202 KR 7601, Training, Education, and Continuing Education. 202 KR 7201, Emergency Medical Responders. 202 KR 7301, Emergency Medical Technicians. 202 KR 7330, Advanced Emergency Medical Technicians. 202 KR 7401, Paramedics. And 202 KR 7540, Data Collection, Management, and Compliance. Again, all of those regulations have been reviewed and approved by the KBEAMS Executive Committee this month, and they'll be heard by the KBEAMS Board on April the 8th. And appreciate the Director of Education, the Director of Data Systems, Bob Andrew and Drew Chandler, and the Education Committee and the Data Collection Committee on working with our collaborators and stakeholders in the field to put together some excellent administrative regulations that will enhance the education of our providers, their ability to function and obtain certification and licensure quickly, and also to streamline our data management program. Also in drafting are 202 KAR 7030 fees, 202 KAR 7 Advanced Practice Paramedic, Community Paramedic, 202 KAR 7 Advanced Practice Paramedic, Wilderness Paramedic, and also on the horizon in pre-draft with medical oversight is a 202 KAR 7 for medical control documents for protocol submissions and for establishing minimum response standards from the state medical advisor in response to our agency administrators in regard to submitted medical protocols. So that's all that I have for you today, and appreciate the KBEAMS staff and their updates today. Our executive director, Michael Pointer, is out this week, and our data systems manager, Drew Chandler, is also out this week. So if you have any questions for us today, feel free to type those into the chat to all. We may be, or to everyone, and we'll do our best to answer those questions. We do have one question up, and I believe that's going to be for our Director of Education and Training, Bob Andrew. Bob, the question is from Alan Bottoms. It says, someone had just mentioned TEI renewal. I was trying to look up our TEI for Campbellsville, Taylor County EMS, but I'm unable to locate it.
However, best it would be to get him that number. Do I give it over the air here, or do you want to respond?
I can give it to him privately, just to him, Bob.
Okay, so my cell phone, thank you.
Okay, no problem. If there's any other questions, Alan will get you Bob's phone number, and we'll get you fixed up. Today is, as Bob stated, the deadline for TEI renewal. So if you have not started that, you are on a pretty tight deadline. Hopefully everyone's been able to take care of that. Next question here is coming through the chat to me. Will temporary card holders be charged a downgrade fee when they apply to revert to their previous license level? Bob, I'm not sure if we have that downgrade fee in there right now, but there may be a processing fee. Would you like to address that one, Bob?
I do not believe there's a fee for that application right now. If there would happen to be a fee, because I've overlooked that in my mind, it would be no more than $10, but I believe it's free.
I believe you're correct. Thank you, Bob.
Mm-hmm.
And hopefully that was for Ben Warford. Hopefully that answered your question, Ben. Are there any other questions, anything that we might be able to answer for you today? I'm sure some of you or several of you are still waiting to hear about your 2021-2022 block grant status, and myself and Paul Phillips and Mike Pointer are still reviewing those. I think we're at the M's right now. We're going in alphabetical order. So we will contact you if anything is needed, and you'll be provided with 5 business days to provide us any additional information on those block grants should there be any additional information requested. But we'll give you a few more minutes for any questions that you may have for the staff.
I'm not sure if everybody's having the problem, but I'm unable to message everyone. So I don't know if that's an issue that's widespread.
I think so. So you can send I've received them privately to me, and I'm not sure what the issue is. It's probably something with the setup that we can handle prior to our next call. But you can send a message privately to my name or to Kaylin Fields, I believe. That may be the issue. We did have some, for Ben's question, Ben, we did have some additional clarification from one of our staff members that the $10 application fee for downgrade, the downgrade app is free, but if you wanted to purchase a new card, you would have to apply for a new hard copy card, and that does come with a $25 fee. We'll give you just another couple of minutes. If there's any questions, anything that we need to discuss, or anything that we might be able to answer and help you with, we'll be happy to do that. Thank you all again for being on with us today. Okay, it doesn't look like we have any additional questions today, but again, we had about 80 administrators on the call today. We sincerely appreciate you taking the time out of your schedule to meet up with us here today, and we look forward to meeting with you again at our next regularly scheduled meeting, which will be on April the 28th. 2021 at 2 p.m. Eastern Standard Time. And I'm sure we'll be sending out some correspondence to that effect to remind you of that meeting. If there's anything you'd like for us to cover in these administrators' calls, we'd be happy to do that. If you just send us an email ahead of time, you can send an email to myself or to Paul Phillips or Kaylin Fields. We'll be happy to discuss anything that's of interest to our providers in the field. I do have a question here. What's the time frame on getting run sheets complete? That's from Alan Perkins. The current time frame for getting EPCRs complete is they have to be complete within 24 hours and provided to the receiving facility. If it's not left immediately, you'll need to complete a continuation of care form with basic demographics and information that's included in the current 540 data regulation. But under ordinary circumstances, you'd want to provide a PCR to the receiving facility no later than 24 hours. And we do want to thank you all again for being with us today, and we'll close for today, but we hope that you have access to vaccination, you have access to PPE in the field during COVID, and hopefully you can encourage your staff to continue to make sure that they're using good hygiene practices all the time, but while on duty, and keeping the units clean, keeping the equipment clean, using the appropriate PPE. So hopefully we can get through this thing and get to a better normal for all of us and get back to normal business. But we do appreciate you, and if you have any questions for us, feel free to submit a support ticket or through the support portal, and we can track that and make sure that we're getting back to you in a reasonable amount of time. And otherwise, we'll see you on April the 28th at 2 p.m. Eastern Time. Thank you so much.